We see them on our way to work or while out running errands, yet most of us just look away when we see people like Judy. We found her sitting outside the Caring Center in Tulsa. She was hard to communicate with.
Do you have some problems in your life?
Yeah.
Like what?
Babysitting. Why does he have to always babysit?
Who?
Wayne. Let's see, Wayne.
She wasn't quite sure of her age and couldn't tell me about her family. Sitting across the parking lot from her was Joe Lipscomb.
Got laid off 2.5 years ago, Smithco Engineering, and Maggie went from $11.26 an hour down to nothing.
The loss of employment aggravated his bipolar disorder, which led him to a life on the streets. Those homeless and suffering from mental illness can come from any walk of life. Wayne Maguire works for NAMI, the National Alliance on Mental Illness for the state. Several years ago, he ended up in an Oklahoma City homeless shelter. He had developed erratic behavior and confused thinking.
Well, you know, it's funny. I think people get the perception that only certain types of people have mental health problems. And I actually was becoming very successful in academics. I had a bachelor's, 2 masters, and finished my PhD. But a lot of things happened in my life, and I started exhibiting what now I realized afterthought was PTSD, post-traumatic stress syndrome. So I started having problems with that and mood disorder as well.
He understands why people with mental illness isolate themselves while their world is unraveling.
I was fearful that someone who once knew me at a different role when I was functioning very well would see me in this condition. And that's what I was most fearful of.
Part of that disease can get people to a point where they're pushing away their family, where they've lost their job, those things that could prevent them from being homeless. So that is the first barrier, is getting people well with their mental health issue, getting them treatment. And we know that today in Oklahoma, if you have mental illness or addiction, 2/3 of those people who qualify for our services can't get it because there's not enough resources there. That directly leads to homelessness.
Terry White is the state commissioner for mental health and substance abuse services.
Over the last 3 years, the Department of Mental Health and Substance Abuse Services has had $30 million ripped out of our treatment system.
She says 21% of people in Oklahoma who are homeless suffer from severe mental illness. Joe Lipscomb explains how hard it is to get treatment when you don't have a home.
When you first get started on your medication, you got to try 15 different things to be able to find one that's going to work. You know, and that takes a lot of patience from somebody that's not mentally stable. You know, much less physically stable.
Lipscomb has no vehicle and lives in a tent encampment. He took us on a tour.
Never mind the mess, because every time it rains, you know, clothes get wet, and then if you leave them in your tent, they get moldy.
He says people come and go from here. A couple and their 5-year-old child slept in this tent up until a little while ago.
Yep, this was what she had to play with. That's all she had.
How long were they here?
About 2 months maybe.
Lipscomb is not on medication and does odd jobs to get by.
I got lucky. I get jobs remodeling and stuff, and people leave things at the houses. So I got me a propane grill.
Wow.
You know, and my tent is big enough that I can wheel this in there during the wintertime and hook some propane to it, and I'll have heat.
Lipscomb says the barriers he and other homeless people with mental illness face is that most of the nonprofit groups which provide for their basic needs do so at different locations simultaneously each day.
Sometimes I'll have to choose, you know, do I want to eat today or do I want clean clothes? Do I want clean clothes or do I want to get my medication?
City Rescue Mission is one Oklahoma City organization trying to provide all social services in one setting. For those suffering from mental illness, filling out the paperwork for those services can be impossible.
A lot of people with disabilities have a difficult time reading and writing and understanding what some applications mean. I have a difficult time doing that at times.
But they can't reach all those in need. A 2011 homeless count put the number of Oklahoma City homeless at just more than 1,200. A count done in Tulsa during the same 24-hour time period showed the number of homeless was 628. And even though Tulsa has a smaller overall population, Commissioner White says Tulsa is doing a better job of helping the homeless.
Tulsa as a community has actually made a pretty strong statement, both from their philanthropic community, along with partnerships from the state and from the city, that say we want to try to end homelessness in Tulsa County, which is an amazing model for the rest of the state to be looking at.
In Tulsa, the Yale Avenue Apartments is an example of what is taking place around the city. Here, those who are chronically homeless and may have mental health issues are given small apartments to live in. Professionals have helped them apply for disability so they can pay to live here.
And so the vision here with the Mental Health Association was that we were going to try to develop housing that we own debt-free so we can offer truly affordable rents to a diverse population, including the homeless and those with disabilities, so that they're no longer priced out of the market.
Greg Shin is an associate director for the Mental Health Association of Tulsa. He says they have established more than 500 apartment units across the city for people like Andrea Johnson. She suffers from bipolar disorder and was homeless until she landed this apartment. With her disability money, she pays $325 a month, and all her needs are attended to, including her mental health.
Well, it's good to, have your own place, cause, cause when you got kind of homeless, it's hard to, survive,
It's my front desk security log.
Back at the Yale Apartments, we meet an employee named Sean Jabbar who works at the front desk. He used to live here. Jabbar was once a homeless veteran suffering from depression and PTSD.
I was probably, going on 15 months, I was homeless. At the time I had a car, so I was living in my car at the time.
After living here and landing this job, he was able to move out and live independently.
So they need really affordable housing, and then they need good support services to go with it. And so since I came here in 2001, that's what we've been trying to do. We've been trying to put those housing properties in place neighborhood by neighborhood across the city.
200 additional apartments are under development in Tulsa. Getting help for those with mental illness is not just about protecting human welfare. Commissioner White says it's also an economic issue.
We have to decide, do we want to continue to pay our tax dollars to clean up the consequences of untreated mental illness and addiction? Or do we want to invest our dollars more wisely and make sure that Oklahomans have the access to health care in the first place so that they can continue to hold down their job, continue to help support their family, and never get to this point in the first place?